The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
So, Dr. Kim, when we're looking at the anatomy and the structures of the face, what are you looking at when you're doing your facial analysis? What are you assessing, and what are you mainly addressing in the face and neck lift?
If you're just looking at someone straight on, you're looking classically at the upper third, middle third, and lower third of the face. So you're concerned about brow position, whether the patient needs a forehead lift or not. You can keep on going down, so you can be concerned, does this patient need an eyelid lift or not? Do they need enhancement to the cheek to actually have it lifted, or to go forward with just fat grafting to the area? And then for the lower third, we definitely have jowling, but what about the nasolabial fold, the marionette line, the lips, and then boom, you're at the mandible already. Finally, you're at the neck, so we are worried about loose skin or not, making it tight but not too tight. And muscle banding is very common here. We can eliminate that muscle banding, the platysma muscles, with a pretty short incision directly underneath the chin, but you may need it, you may not, and it just depends. And then when you're looking at the face, Dr. Hamilton, and the neck, I know that I just discussed anatomically looking at it from the front, but the deeper structures underneath the skin, what are you looking at, as well as what are you looking to actually tighten to give the best long-lasting result?
That's a great question. So we are looking at obviously the quality of the skin. We see the platysma muscle that you mentioned before. So that's the part when you strain that sticks out, and the bands that you're talking about. So we want to make sure that that's nice, smooth, and tight. Then, so fat that's underneath the skin, we can address that with a minimally invasive procedure like segmental liposuction, but oftentimes there's fat that's deeper, that's below the platysma muscle. So we have the opportunity to address that when we do a neck lift, because we're directly looking at it. And then some patients there's other structures. Some people, they have prominent muscles that are underneath this chin area here, prominent salivary glands called the submandibular glands. So for some patients, those are very prominent as well. And that can be because they're sagging and kind of herniating outward, or it can be just because they're big. So I don't think those should be removed or addressed in every single patient. You also don't want to make a neck that looks skeletonized. But for some patients, you're not going to be able to get as nice of a contour if you're not tightening the strength structures and also removing some of these bulky structures.
And to toot our own horn, we wrote an abstract on how to actually eliminate or diminish these salivary glands, the submandibular glands, without surgery.
Yes. And we looked at injecting Dysport, or you could use any neuromodulator like Botox. And what we found is that this is a very, very safe way to shrink the salivary glands without having to surgically remove them, because there can be complications associated with that procedure. It works really, really well. And interestingly enough, we see that after one or maybe two treatments that it doesn't seem to get big again, which is nice, but your salivary function still works. Although I had one patient that had a little bit of a dry mouth afterwards, but it was temporary.
That's great. Yes, so it works for those people out there.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.